My name is Malik Dade, and I will be your nurse for today. I have checked your doctor's orders, and it looks to me that you'll be getting an intramuscular injection for today. Alright, so there are 5 locations to this particular type of injection. You have your deltoid, which is in your shoulder. You have your ventral gluteal, which is in your hip. You have your dorsogluteal, which is in your butt. And then your fourth and your fifth, which is your vastus lateralis and your rectus femoris. They're both in your thigh, where the lateralis is kind of more downward and to the back. And the femoris is more upward and kind of to the front of your thigh. Alright, so now let me wash my hands. So while I'm washing my hands, can you please state to me that if you have any allergies to any medications or anything? Alright, so that's good. Let me just check your ID band here. So can you please state your name and your date of birth for me? Alright, that looks like the correct information. So according to the MAR, Medicine Administration Record, you received this shot yesterday around 12 o'clock in your vastus lateralis location. Am I correct? Alright, correct. So today your pain is a 10 on a scale from 1 to 10, 10 being the worst, huh? Alright. So the doctor ordered you to get a 7.5 milligram shot, but the medicine only comes in 5 milligrams per milliliter. So I'm going to have to convert that. So I put my 7.5 milligrams over 1, and I multiply that times 1 milliliter over 5 milligrams, where the milligrams cancel out and leaves me with 7.5 over 5, which equals 1.5 milliliters. So 1.5 milliliters is what I'll be giving you today. All right. Now that we've done all that, let's prepare. So in this process, I will need some alcohol wipes, the actual medicine, of course, the syringe, a 3 ml syringe, and the appropriate needle for the process. First off, what I want to do, I want to look into the medicine and make sure I don't see any debris, and check the expiration date and make sure that the expiration date has not went out, which it has not. Alright, I want to take an alcohol pad and I want to clean the vial. Keep it sterile. Alright, so after I clean that, I throw that away. Alright, I got my needle. I pop the top off. Alright, I want to aspirate it to 1.5 because that's what I need. So aspirate it to 1.5. Alright. Put that into the medicine. Turn it upside down. Push that air in. And then aspirate it to 1.5. Alright, so we got it at 1.5 right now. If you can see that. Alright, so I will put that top back on. Alright, so I would twist that off and put the appropriate needle on. Alright, so now I come to my patient's room and I position him in the correct position. I rechecked to see if he had allergies. I prepared the medication, and when preparing that medication, you want to check that medication 3 times. You want to check it when you get it out of storage, before administering it, and also you want to check it while you're preparing it, right before you prepare it. So I positioned him in the correct position because I'm going to give it to him in his deltoid because he's in pain. I don't want him to move too much. So I just exposed the deltoid area. I put my gloves on. I performed my hand hygiene. Now I'm going to get an alcohol pad and I'm going to cleanse the area I'm going to give it to him in for 30 seconds, going inward to outward. All right. So I dispose the alcohol pad, and I get the needle and I put it into my dominant hand. Alright, I disengage the safety, pull off the top, and what you want to do, you want to give the shot to him in a 90-degree angle in a dart motion. So I get it, give it to him, I aspirate. After holding it with my non-dominant hand, I grab that and aspirate for blood, and then I give them the shot. Pull it out swiftly, put the top back on, gauge the safety. Now I can dispose of this. Alright, so next what I want to do is grab another alcohol wipe and massage the area for the appropriate amount of seconds, and then put a bandage or a cotton ball with a piece of tape on it for bleeding or anything like that, and for it to not, get debris in it or whatever. After I've done all that, of course, I reposition my patient for him to be comfortable, him or her to be comfortable, and I document. And that is how you give an intramuscular shot. Thank you.